Hello everyone, today I will talk about dysmenorrhea, and dysmenorrhea actually is a cystic pain that associated with every cycle. And there is a bunch of, group of symptoms that come each cycle, and this group of symptoms, we call it dysmenorrhea. That include low backache, headache, diarrhea, nausea could be also, and also could associated with vomiting. The crampy pain with each menses having two types, okay? Primary one and secondary one. These two types actually differ by the time of onset of each one. Primary dysmenorrhea, it actually starts within 6 months, or it could be extended until 12 months after the first menses, while secondary dysmenorrhea, it comes later in life, so the age either in 20s or 30s. And primary dysmenorrhea, there are actually a bunch of factors, or let's say group of factors, that come to increase the possibility to have this girl, or let's say this group of girls, to have dysmenorrhea. And these are when they had earlier age at menarche, and long menstrual period, also smoking, and last one is increased BMI. While secondary dysmenorrhea is associated with underlying pathology that include endometriosis, leiomyoma, adenomyosis, and endometrial polyps. What dysmenorrhea actually, if there is no identifiable pelvic pathology, we will explain it now. That here, let's focus here, please. This is endometrium, and then when cycle come, there will be endometrial sloughing, so that wall will start sloughing. This sloughing will release an prostaglandin. Prostaglandin will result in inflammation and with pain. And we confirmed that by found prostaglandin level increase or be in highest level in the first 2 days of menses. That prostaglandin will result in myometrial contraction, vasoconstriction, end up with uterine ischemia and pain. The diagnosis will be either it is primary dysmenorrhea or secondary dysmenorrhea. If the patient have a menstrual cramp and there was no associated symptom, there was no red flag, actually no evaluation may be required. But if the woman have a menstrual cramp and it's actually suspected that having secondary dysmenorrhea rather than primary, the symptom come later in life, and there is risk for pelvic inflammatory disease, so we will take a test of nuclear acid amplification test. That is very specific test to detect Chlamydia trachomatis or Neisseria gonorrhoeae. This test will take small amount of bacteria, and their genetic material there will be amplification for that genetic material, so even small amount of bacteria can be detected. The treatment actually starts with NSAID. It's symbol and also preferred, and we will ascending according to symptom. So if woman there is pain still after taking NSAID, we will go into combined oral contraceptive pill or even continuous regime if pain persists, and we can also give progestin only contraception. Some say is that if pain still persists, they can go even to hysterectomy, but hysterectomy meaning there will be no fertility, so we will not talk about it. There is other agent but have limited evidence, they say, that show beneficial for women that include vitamin E, dietary oils and low-fat diet, and some Chinese herbal medicine. Okay, at the end, let's talk about what these drugs will do. Actually, this is the endometrium. It will try to thin the lining of the wall, so it will decrease prostaglandin release. So instead of that sloughing that end up of releasing prostaglandin, the wall will be thin, so less prostaglandin release, less vasoconstriction, less uterus cramp, Spain. That's we all talk about. Thank you, and we wish that you guys subscribe our channel and help us to get bigger and try to make more beneficial video. Thank you and bye.